Greetings and salam sejahtera, everyone. I hope you can hear me. Right, I'm Associate Prof. Dr. Rosie Pamela, and I will be the moderator for your second part of today's live webinar series on breakfast at UMHealth. Let me introduce our esteemed speaker now. Dr. Intan is the head of the Department of Anatomy. She is a medical lecturer who obtained her master's and PhD from the University of Western Australia in the area of reproductive biology. Let me see. Her work is on fetal programming, which investigates the effects of maternal exposure to drugs or adverse dietary substances and studies the short or long-term outcomes of pregnancy and offspring health. Also, she explores dietary modifications possible for addressing obesity and disrupted metabolism. Today, this remarkable researcher will speak on fetal programming of metabolic syndrome, understanding the mechanisms and possible interventions. With this, I pass the floor to you, Dr. Intan.
Thank you very much, Prof. Rosie Pamela, who's my dearest colleagues. Today I'm going to talk about my project. I've been doing this for many years now, and since my master and PhD time in Perth, and now continuing it in So fetal programming of the metabolic syndrome is roughly a newer topic in Malaysia. So before I start, maybe I should give a definition of fetal programming. Currently, it is also known as developmental programming, a newer term for fetal programming. In developmental programming, we are interested to look at how anything associated with the mother, such as her fluctuation in body weight, health condition, medication that she takes during pregnancy, her mental status, whether she is happy or there's a lot of depression, anxiety, and fear and stress. Anything that she consumes, for example, any high-fat diet, high-sugar diet, alcoholic beverages, state of hydration, as well as her physical activity or lack thereof. All these will affect the baby that she carries. So this is the term fetal programming, which is essentially how the first 1,000 days of your life from conception onwards actually provide a lifelong effects to you and the susceptibility to develop adult onset diseases. So in these 1,000 days of conception, it also includes breastfeeding, any extended and ICU stays, and also postnatal, perinatal infection. So it's quite a varied type of research along the perinatal period. So now the condition, the diseases that the person developed because of programming effect is called the developmental origins of health and diseases. The society is relatively new, around 15 years of age, but they have done a lot of progress in these 15 years. So the person that we are really interested in when we are talking about fetal programming is this baby that was exposed to adverse maternal condition and how the baby eventually carried out his life. So when a person is exposed to a lot of adverse condition, there's a lot of stress hormones being released by the mother. And this stress hormone will reduce the availability of nutrients, which will definitely impair fetal growth. Because of the limited source of nutrients and fuels to the developing fetus, what will happen naturally is that the preservation of important organ development at the expense of other metabolic organs, such as the heart, kidney, liver, fat tissue, so on and so forth. So the brain gets preserved and all these other organs suffer for it. That's why when we do ultrasound, we would see that, there's discrepancy between the head circumference and the abdominal circumference. So this individual, in the 9 months that the individual is in the mother's womb, they develop, when they are exposed to this adverse condition for a long time, they develop this condition called thrifty phenotype. It's a hypothesis, but we've seen it happening already. So thrifty phenotype means that because these metabolic organs are so deprived of nutrients when it is being formed, later on when they are in the postnatal world where nutrients and food are all abundant, they will tend to hoard all these nutrients, and any small amount of sugar will be converted to fat very, very fast, and they will have a very slow type of basal metabolic rate because they want to conserve this energy. So what we have seen happening from my study and from other studies as well is that immediately in the postnatal period, we see IUGR because of the inadequate growth. But then there's a rapid growth, there's obesity happening. And if you follow this individual for a long time until middle age, for example, you see the development of metabolic syndrome in the form of hypertension, diabetes mellitus. There's also systemic inflammation and reduce in their immunity. So definitely that's the core definition of metabolic syndrome. You may want to ask how this happened. So basically, as you grow, when you are exposed to this adverse condition, you didn't actually have any alteration in the genetic profile. What actually happened from our research is that there's epigenetic modifications, whereas there's excessive DNA methylation instead of chromosomal reduction or anything like that. These are only subtle changes, but these subtle changes really changed how these genes are being expressed and produce a different type of phenotype. What we have seen clinically is that usually these individuals will be born IUGR at birth, but they will show rapid weight gain, or we call them catch-up growth in the first 12 months of life. So when you see something like this in a hospital, you should be wary that probably this baby have been exposed to adverse pregnancy conditions. It can be anything. Adverse pregnancy condition can be anything, but mostly stress lah. So now we follow through this individual until adulthood. They are already born with this defective type of metabolic phenotype. So when are they supposed to completely just fast all the time, avoid fatty food? That is something that we cannot avoid, and we also don't know whether we were born with this phenotype or not. So it is something unavoidable that these people will eventually be exposed to this nutrient dense environment when they are born. So we wanted to ask whether this phenotype will be exacerbated by high fat diet. Okay, high fat diet can be from all the fast foods, and even Malay foods also, we have a lot of high fat in them. But this study, bear in mind, was done in rats. So we cannot really see the effect on body weight because rats are able to auto-regulate in terms of their food intake. So there's no weight gain. The animals, the normal and the programmed animals who are both who are exposed to high-fat diet, the programmed animals didn't show any extra weight gain. But when we assess further, we notice there's increase in visceral adiposity, meaning that the visceral fat deposition is very, very high. This was done using dual X-ray absorptiometry. There was also hypertension. This was done using tail sphygmomanometer. We also noticed massive systemic inflammation with increase in TNF-alpha, IL-1 beta, IL-6, both plasma and also in the tissue gene expression. And last but not least, hepatosteatosis. This was done using cryosection and oil red O stain, and we quantitate after that. So definitely, this 50 phenotype hypothesis is happening and is being exacerbated by the postnatal environment of high-fat diet. So is there anything we can do? Is there any intervention we can do? Because we know that this is happening in the adult population and in human actually. And human, unlike rats, we do not auto-regulate. When we see fat food, we tend to eat more of them. So in this study, we also tried to venture into what kind of rescue we could provide for individuals, these susceptible individuals. So in the study, we tried to give high omega-3 fatty acid supplementation, which is very, very high. This is equivalent to 3 meals a day of high omega-3 fish dishes. So every meal you are supposed to eat high omega-3 fish dishes, or you can also take high levels of omega-3 supplementation, highest level. So was there any improvement in this rat study that we conducted? Yes, there was increase in BMR. We also saw improved vascular reactivity, fatty acid oxidation was happening even more, and there's improved blood glucose levels as well as reduced inflammation, general inflammation in the body. So after all that, we know that something must be happening inside the body that triggers all that, other than possibly the inflammatory markers. Could these programming effects and the exacerbation by high-fat diet afterwards actually be due to something else? And we were thinking about, could these actually, disturb circadian rhythm? And that's why these people are like that from the start. And then, they are very, very vulnerable for the subsequent effects in the postnatal life. So the high amount of glucocorticoids that they were exposed to in utero have definitely affected them. And the reason why circadian rhythm came to our mind was because circadian rhythm controls everything in the body, controls our sleep-wake cycle, coordinate feeding and the metabolism, decides on hormonal release, and responsible to initiate daily metabolic activities. We have seen reports, various papers, you just Google it, and there's a lot of papers saying that disruption in circadian rhythm, especially in shift workers, causes metabolic syndrome, and this is also correlated with how long they have been doing this shift work. And in this profession, we do tend to do shift works, and the studies, many studies have shown that the longer you have been involved in shift working, the worse your metabolic profile is going to be. That is, if you are a non-smoker. That is, if you are non-obese. When you also have additional comorbidities, it is even worse. So there's also increased risk for stroke and IHD for these individuals. So if circadian rhythm is disrupted, this is going to be seen. So we thought that maybe, fetal programming actually also program a little bit of the circadian rhythm. So we also wondered whether high-fat diet would worsen the condition, and whether omega-3 fatty acids could rescue this abnormality in the circadian rhythm. We didn't know whether it's going to be abnormal at all. So we did a study, okay? But before I proceed with the results, maybe I should mention a little bit more about the circadian rhythm, because not everybody is familiar with it. So the control of circadian rhythms in our body is actually high here in the suprachiasmatic nucleus. There's a clock gene machinery that controls our circadian rhythm. So these clock genes is basically has these two precursors called the BMA1 and clock. This combination of these two proteins, when they are combined together, okay, they will initiate the translation of PER1, PER2, PER3, as well as CRY1 and CRY2 mRNA expression in the cell. And what will happen is that there will be concurrent increase in the levels of PERS and CRYS proteins in the cytoplasm, and the high levels of these proteins will eventually send a feedback mechanism to the BMA1 and clock and stop this clock action. So what triggers the initiation or the binding of BMA1 and clock? The initiation of clock genes activity happens at the first time you see light or sunlight, for that matter. So that first exposure to sunlight is called Zeitgeber time 0. Okay, so for diurnal individuals like you and me, okay, our Zeitgeber time Zeitgeber 0 time is usually at 7 a.m. when you see the first sunlight. And for nocturnal animals like rats, because they are nocturnal, they're active at night, so their Zeitgeber time 0 is at 7 p.m. Clock genes doesn't only present in the suprachiasmatic nucleus, which is, thank God, all of our other body tissues also have clock genes machinery, for example, the heart, kidney, liver, and adipose tissue. So in case there's a tumor, for example, that's completely disrupt the clock gene, the central clock genes mechanism, the individual organs is able to initiate. But the importance of having SCN clock genes machinery is that it will regulate the rest of the body clock genes mechanism as well. So now let's go back to the findings. So we look at the liver, okay, which is the organ of interest in for the current talk. We saw that there's no programming effects affecting the liver. You can see that this is a control animal who are not exposed to any programming effects. This is a dexamethasone animals or program animals. We induce the programming effects using dexamethasone, which is a stress hormone. When they are exposed to high-fat diet, HFLN3 means high fat with low omega-3 content. When they are exposed to high-fat diet, both animals definitely show a lot of fatty deposits. The fatty deposits in it is in red color. And when they were given high omega-3 supplementation, you can see that a lot of that fat is also being removed by the liver through the help of omega-3 supplementation. So we were quite happy to see no programming effect of the fatty liver, meaning that our liver will still be good if you are not eating any high-fat diet. But yes, high-fat diet will induce fatty liver, and that high omega-3 supplementation would partially rescue our fatty liver. Next, we looked at the gene expression. So first, we look at BMA1. BMA1 and clock, if you remember, they form this heterodimer. The way they express their gene expression would be similar. So I'm not going to talk about the clock genes. I'm going to talk about the BMA1 only because their patterns basically are similar. So this graph, the white one indicates daylight time. The night one is the night time. This is how BMA1 expression pattern should look like. Okay, so we took these tissues were taken at 4 Zeitgeber time, ZT1 meaning at 8 p.m. for the animals, ZT7 at 2 a.m., ZT13 at 8 a.m., and ZT19 at 2 p.m. So usually circadian studies, the more time points you do the tissue collection, the better. At least 3, we only managed to have 4. So this is a control standard expression profile for the BMA1 gene. So similar, roughly similar to what we would expect for BMA1. So this is the expression pattern for those animals who were exposed to programming effects, you can see there's similar type of expression pattern. This is in the liver. And also when they are exposed to high fat diet, no change, not so much change. And even after they receive high fat, high omega-3 diet, the expression pattern persists. So we are so happy to see that our main precursor of clock gene expression, both clock and BMA1, are normal regardless of all these type of abnormalities that we induce on the rats. So we can safely say that, you know, we have the body somehow have the mechanism to protect the BMA1 and clock genes. Next, we look at PER2 gene. There are 3 PER genes, PER1, PER2, and PER3. But all these PER genes expression profile are very, very similar. So I just decided to choose the PER2 genes. So this is the expression pattern, both daytime and nighttime. So the pattern increase until, you know, dusk and then goes back down towards nighttime. So here, what we saw, so this is our control index, not much change as well, which is very, very good. And then high fat diet somehow reduce the PER2 expression a little bit so that the rhythm becomes dampened a little bit. And then high omega-3 supplementation in orange actually brings back the rhythm to normal, but doesn't really achieve normal, but you know, there's a little bit of a rescue there. Next, we look at CRY2 gene expression, which represent both CRY1 and CRY2. So CRY1 gene expression was like that for the control, in blue, and when they're exposed to high-fat diet, the diet flattened CRY2 expression. And when we give high omega-3 supplementation, there was like, you know, not really a return to the normal rhythm as well. So we are not seeing a complete normalization of the gene. What happened, interestingly, is that CRY2 gene expression was completely flattened when these individuals is exposed to programming effects. So we thought all the clock genes would be preserved, but no, seems that CRY2 is severely affected. And when the animals were given high-fat diet, it was even worse. And high omega-3 supplementation didn't even close to rescue the effect of high omega-3, the high-fat diet, and couldn't even rescue the effect of programming. So this is when all the lines are there. So the conclusion from this study was that, okay, so the programming conclusion, we are so happy that dexamethasone or the stress exposure does not increase susceptibility for fatty liver. However, in the clock genes, we saw suppression of the CRY2 expression. Other genes seems to be preserved. Okay, for diet conclusion, we saw that high-fat diet consumption do result in fatty liver as expected, and high omega-3 supplementation partially rescued fatty liver in both control and, you know, the programmed offspring. So here is the rescue by high-fat omega-3. So high-fat diet suppressed the PER1, PER2, PER3, CRY1, and CRY2 expression. All these expression are suppressed. And then, but the BMA1 and clock heterodimer, the precursor, remain intact. What we saw is that there's also failure of the clock BMA1. There seems to be a failure of the clock BMA1 heterodimer to mount a significant downstream effect to actually initiate this. So something is being disturbed at this particular level because of postnatal diet. Next, high omega-3 diet corrected or partially corrected the suppression we saw on PER1, PER2, PER3, and CRY1, but was not able to repair the problems we saw related to CRY2. That was probably because the rescue effect couldn't be seen because CRY1 is suppressed both by the programming effect and by the high-fat diet. So now we realize that individuals who were exposed to programming effects, it could be any of us, it could be all of us actually, because my mother was a student when she was having me, so I'm sure she was under a lot of stress, and probably I'm also a product of programming. And I'm also exposed to all these high fat diet around me all the time, so I know I'm susceptible. And it's scary to see that high omega-3 couldn't rescue this completely, could rescue a little bit but not all the way. So now I'm also trying to study how the programming effects is affecting the baby, probably through placenta. So our current study is trying to see the effects of maternal hyperglycemia on placenta morphology and function. We believe that placenta, being the intermediary organ between the mother and fetus, could also be suffering greatly due to maternal diseases and diets. So from our preliminary results, we've seen some reduced placental efficiency. We saw some altered placental morphology, reduced placental vascularization, and increased placental inflammation. But all this data has not been presented yet or published yet, so maybe I'm not going to talk about them in so much now, but inshallah soon. And with that, I thank you.
Thank you very much, Dr. Intan, for sharing with us the insights surrounding fetal programming. What we actually see as abnormality in a child or individual is so far and deep from what actually occurs during not just the in utero development involving epigenetic modification, but also I see that a lot of factors such as stress and even postnatally lactation is playing a huge role. Thank you so much. Let me check whether there's any questions in the Q&A. Not in the Q&A box. Anyone has any questions to ask? I'm really interested that there's a lot going on there, Dr. Intan, and it's amazing work, especially involving this clock gene machinery. There's a lot of things there. And if there is no other questions, all the best for your upcoming research in hyperglycemia. Yeah, so I think that, you have anything to add?
Thank you so much, Dr. Pam.
Okay. Right. If there's nothing else, that brings us to the end of today's Breakfast at UMHealth live webinar series. Thank you, everyone, and have a nice day. Goodbye.
Bye.